Hello everyone, welcome to my channel. This is my very first video for the pharmacy students. On this channel, I'll be sharing clear and simple explanations of important pharmacy topics. And today, as this is the first video, I am starting with a basic term which is a pharmacotherapeutics. This is a term which you will be hearing in most of your subjects. So today I'm starting what is actually a pharmacotherapeutics. Before starting about the introduction of this pharmacotherapeutics, I would like to explain you few terms again. Those terms will be used in your subjects or these are your subjects, and this will tell you exactly what is pharmacotherapy because these all subjects are interrelated. So the first subject which you will be studying in your first year of B Pharma, PharmD courses or maybe diploma. So anatomy and physiology. All of you are very much aware what is anatomy, what is physiology. So here I think I have no need to give you a much deeper explanation. As we all know that anatomy is the study of the structure of human body parts, how exactly a structure looks like, and physiology is how that structure is actually work to maintain our life. For example, if you will tell, there are many kind systems are there in our body: reproductive system, digestive system, skeletal system, muscle system, urinary systems, lymphatic system. Each and every system is having different body parts. Some are organs, some are small body parts. There are many things in that one particular system, and that one particular system will work, and it will again connect with the other body parts, and both together will work, and then our body will function properly. So if you will see in physiology how your kidney will work with liver, how they both are related to each other. Kidney is a part of your urinary system also, but somewhere it is having a role in your digestive system also. So how these both systems will work together so that our digestive system can work properly. Coming to next, this is pathophysiology. This is again is a very interesting subject which you will be studying in your second year of B Pharmacy and PharmD. So patho, it's a disease, but physiology, how the functional things will come, and logy, as you know, it's a study. So in this subject, we are going to study if any disease is affecting your body, how your body will react for it, how you will came to that some disease may occurring or in future may occur, how the changes starts in your body. Because how this pathology only, this pathophysiology only will explain you how a normal person will convert into a patient, how he will become a patient. Once this pathophysiology will come for any disease, any kind of disease, doesn't matter it's a small disease or big disease, chronic or acute, severe or what, but how this pathophysiology is will affect our body. This pathophysiology again is having many vast role in all the, if you will study pharmacotherapeutic for any diseases, suppose you are studying for urinary diseases or reproductive related diseases and respiratory diseases, any asthma, any heart related issues, but before starting for a treatment you should first understand how this disease started in this person. If I'm telling that today a person who is 20, he's having smoking from past 20 years, and today after 20 years when he is in his 50s or 60s, he got his COPD or any respiratory issues, any lung related disease. It's not like today only he got this disease. Maybe since in past when he was having the smoking, at that moment slowly a minor changes which was not visible that time, it started in his body, and that slowly once the minor changes are accumulating together, they are affecting the body parts, not exactly the lungs but inside deeply in lungs. Again Your alveoli are there, bronchi are there, bronchioles are there, so many body parts are there. So for that reason only, before understanding this pathophysiology, we should first understand human anatomy and physiology. When we know what body parts are there in the lung, then only we'll understand how these body parts are getting changes when any disease is occurring. And then once you will understand, okay, these are the body parts, it should work like this, and now they are not working like this, so it means the disease is coming in this way, and this kind of disease he may get affected after. Today if he got diagnosed, he may had this issues, and slowly the things accumulated, and now he is affecting with this disease. So first we should know human anatomy and physiology, then we should understand the patho, and once we know the patho, we know, okay, now we know how the disease is occurring in his body. Now we know what kind of treatment we should start. And when the patient comes in front of a physician, he may come with some kind of symptoms. It's not like today only. Few symptoms are basic, acute symptoms like allergic things, bacterial things. Few symptoms or signs will be which will be severe, which will already coming from a chronic diseases which is started long back. So how the physician will understand it's acute or chronic based on its systems, the sign and symptoms what he is showing at that moment, then he will use his knowledge and he will try to check, okay, these are the physical examination, these are the symptoms, these are the tests. Altogether he will understand, okay, the patient is maybe getting this kind of disease. If he will be having any doubts, then he will ask the patient to go for some further test, which will again clear the diagnosis. So this is the very important part, pathophysiology. Next, once you know the patho, okay, this is a thing, patient is having this problem, these are the things. Now things started pharmacology. In pharmacology, it's a very important thing for any pharmacy students, because pharmacology where we'll be studying about drugs. Here drugs doesn't mean those drugs which we'll be using for addiction. Drugs means, you know all, that this is medicine. So we study about the drugs. Again, when we are studying about this pharmacology, it again divided into two types. One is pharmacokinetic and then is dynamic. When it is coming with pharmacokinetic, it means when a patient is taking any drug, so how that drugs is affecting to the, how the patient body is affecting to this drug. So suppose a patient takes any drug, the four things are there for kinetic, that is absorption, distribution, metabolism and excretion. Absorption, which can occur through mouth, stomach, eyes, lungs, whichever part the body the medicine is entering to the body. Then it again depends what kind of chemical, what kind of drug it is there, then by which route we are giving this. It the drug is having any kind of interaction with anything, doesn't matter with other drug or with food or with the body conditions, anything. Then next comes distribution. Distribution where, which exactly tell us how the drugs move around the body. We took the drug, now it got absorbed, but after absorption it will move whole body, and it will understand where it has to go and it has to show the work. It's not like if I am having pain in knee, I will take the tablet from mouth only, but how the tablet which I'm taking from mouth, it will giving me relax in my knee pain. So that all things comes with this ADME. Distribution again, it has many parameters to understand, like how the drug is crossing the body parts, how it is crossing the capillary walls to enter any tissue, how the tissue penetration is going on, how the drug is traveling. Next comes with metabolism. So how the metabolism again, this how this chemically alter the drug which is getting absorbed into our body after distribution, how it will metabolize. In that again there are phase 1 metabolism, phase 2 metabolism. There are many genetic factors which are having a role in this. Then next is excretion. Finally, after absorption, distribution, metabolism, the drug has to excrete from the body. So how it is getting excreted, in that again age matters, many genetic variations are there, your the patient health condition also matters. So, and the proper dosing. So this ADME will tell how much should be the dose for any patient. So these are very important parameters. Next are pharmacodynamics. Dynamics is how medicine works in the body. The patient took the medicine. Now how the as per patient body gave the medicine dose, but now how the medicine will actually show its effect. So again here many things are there, whether if the patient is taking 2 or 3 drugs together, so those 2 drugs are an agonist, antagonist, what is the duration, what should be the dose, what should be the therapeutic level to maintain the effect of the dose. These all things comes under pharmacodynamics. Here I'm not explaining in the detail because the main term which I'm going to explain is pharmacotherapeutic. But before understanding this pharmacotherapeutics, we should know what is pharmacology also, because this also having a major role in pharmacotherapeutics. At the last, pharmacotherapeutics. So the pharmacological knowledge to prevent, diagnose, treat the diseases or the modify physiological functions. Now here, any patient who got any kind of diseases, first we know, okay, these are the structures. Suppose any cardiovascular diseases, any reproductive system related diseases, brain related issues, we know, okay, these are the body structure. This work like this. Anatomy and physiology over. Next comes pathophysiology. Okay, these are the things. How this patho started, how the disease started in his body, from where it came. And then next will be pharmacology. Then all club together and comes with pharmacotherapeutics. So these anatomy and physiology, pathophysiology and pharmacology knowledge is very important to understand pharmacotherapy of any disease. Pharmacotherapy, when we explain for any kind of diseases, doesn't matter if it is respiratory, skeletal, any urinary related issue, cardiovascular disease, whatever diseases. So before explaining about the pharmacotherapy or before studying about the pharmacotherapy, we should know what is the diseases. Whether it's a brain related disease, it's a heart related disease, it's a respiratory disease. Once we know, okay, this body part is getting affected, so this system, body parts, all the body parts which will come in this system, these are going to get affected. Next, once we know these are the things, okay, then sign and symptoms. The patient will come some sign or symptom. Now there is again a difference between sign and symptoms. So symptom which the patient will be feeling, a physician cannot get it. He has to ask to the patient only. Patient will say, I am having pain. Patient will tell, okay, this is my pain. I am getting pain here. I am getting this burning sensation. I am feeling this irritation, itching. I am feeling dizziness, giddiness. All these things a physician can't get. He has to ask to the patient. Sometimes it may deviate the diagnosis also. How? Because sometimes patient may not able to explain it properly. So there is a chance that physician also may get confused. Okay, which way he's telling. But there the physician will use his knowledge, and by seeing the symptoms, he will go with the signs. He will see signs which he knows. Okay, these things should be there. If he is telling me the symptoms are related with this diseases, so there may be these signs also. Then he will correlate those things, sign and symptoms, with the other test, laboratory test, the vitals, the physical examinations. So all these things club together, and then there will be a etiology. Etiology where we will going to explain the causes. What made this? Whether it is because of any bacterial things, any other allergic things, whatever can be the cause for that particular disease, will rule out all the things. Then next is pathophysiology, as we know that these are the signs and symptoms, these are the causes, and next we have to explain, okay, how these causes aggravate or how these causes started these diseases by which the patient is showing all these signs and symptoms. Once we understand all those things, then come to, okay, this is the proper diagnosis. So the patient is having this particular disease. Once the diagnosis is done, based off that, we will go with treatment and management. Now here there is a difference between treatment and management. Treatment shows, treatment tell us, okay, patient is having cough, we gave him a cough syrup to treat it. Now, management will be, if the patient got cough with allergy, we will explain the patient, you may have allergy with this particular thing, kindly avoid it, so that in future also you may not get this cough again. Second thing, sometimes some diseases are, it cannot cure completely. We have to manage those diseases so that the patient symptoms may not aggravate again, or patient may not get those symptoms again. So there comes the management. We will treat for his symptomatically whatever the symptoms are there, we will treat the patient. But parallelly, we will start managing the conditions. Okay, he should not get this in future. So we will explain him, we will counsel him. So this comes the management. Now, what are the objectives of pharmacotherapeutics? Why it is important? It, it is important for the safety of prescription, so that the side effects can be minimized. We know what exactly the patient has, and based on that only we are giving the medicine. Next is, what is the patient problem? So we actually understand what can be the, what is the diagnosis and what exactly he is having, to prepare an appropriate therapeutic plan. Now I'll explain in next slides that what is this therapeutic plan. Next is to avoid the medical errors, any kind of side effect, any kind of medical errors. To ensure the patient compliance. Compliance means we know whatever medications we are telling to the patient and how exactly he has to take, he is actually adhering to it. He is taking accordingly so that he will get the proper benefit. Sometimes we will explain the patient, okay, this is your medicine, go and take it. Patient may forget it. If he is an aged patient, he may forget it. There are many reasons which can come for this non-adherence. So there again, we should go with it. To understand the benefit of the drug therapy and to maintain the drug therapy cost also. If the patient is not taking the medication properly and we are not going with the proper plan, sometimes it increase the cost for the patient. So economically also we have to understand. So this pharmacotherapeutics will help us, because economy is also a part of this pharmacotherapy. So today we learned the basics of pharmacotherapeutics and how it connects with clinical practice. In the next sessions, we'll go deeper into this specific topic. If you found this useful, please give it a like and don't forget to subscribe so you didn't miss the upcoming lessons. Thank you. Bye-bye.